Hello and welcome back to the Nurse Navigator Network, where we take your NCLEX prep to the next level. Are you struggling with NCLEX priority questions? You're not alone. These questions can be tricky, but today I'll show you a proven strategy to answer them correctly every time. Plus, we'll go through 10 practice questions together with explanations to help you feel confident using this method on exam day. Hey, I passed on the first try, so now you can find out how. Understanding NCLEX priority questions. You can generally identify a priority question because it will contain any of the following words: best, initial response, priority, highest priority, most important, first, most concerning, or most appropriate. In multiple choice questions, there are usually two answers that you right away will know are incorrect. The remaining two can often be similar, but one of them is more correct. Priority questions test your ability to recognize what's most important in patient care. But how do you determine what to do first? The NCLEX uses three main priority frameworks to guide your decision making. Number one is ABCs, airway, breathing, circulation. Those life-threatening conditions are always going to be coming first. We want to put those first every time. Number two, safety and risk reduction. You want to prevent harm by addressing safety concerns. And then number three is the nursing process. Some use the term ADPIE, which is assess, diagnose, plan, implement, and evaluate. Assessment usually comes first unless immediate action is needed. Now, let's apply this strategy to 10 NCLEX-style questions. Pause the video if you need extra time to think. Question 1. A nurse receives 4 patients in the emergency department. Who should be seen first? A 45-year-old mild abdominal pain and stable vital signs. So a 45-year-old with mild abdominal pain and stable vital signs. B, a 60-year-old diabetic with a blood glucose of 250. C, a 25-year-old with an open leg fracture but stable vital signs. Or D, a 70-year-old with a respiratory rate of 8 breaths per minute. Pause here. Who is your priority? The correct answer, D, the patient with a respiratory rate of 8 breaths per minute. The rationale: this patient has an ABCs issue, so airway, breathing, circulation, and they may be experiencing respiratory depression, which is life-threatening. So you want to think in terms of what is going to kill this patient the fastest. And generally speaking, the person who would die the fastest in this question would be the person with the breathing problem. Okay, question 2. A nurse is caring for a post-op patient who is restless and has an oxygen saturation of 89%. What is the priority nursing action? A, administer pain medication. B, apply oxygen and assess airway. C, call the provider. Or D, document the findings. Okay, let's pause and think about that one for a moment. The correct answer here is B, apply oxygen and assess the airway. So again, it comes back to the ABCs here. So you've never put pain medication before oxygenation. And while in some cases you would call that provider, generally you have to think in terms of, if you call a doctor, they're going to scream at you if you tell them, yeah, I have a patient that's having shortness of breath, but I didn't do anything. I just called you. So you want to do that second. So oxygen saturation here, it's below 90%, which is critical. And since airway and breathing are compromised, oxygenation is the priority before notifying the provider. So always remember what will kill the patient the fastest and how can you prevent that. Question 3. A patient with COPD reports increasing shortness of breath. What should the nurse do first? A. Check the oxygen saturation. B. Encourage coughing and deep breathing. C. Call the provider. D. Increase the oxygen to 6 liters. Okay, let's think of this one. All right, so basically this is a situation where their respiratory status is worsening. So the correct answer would be A. Check the oxygen saturation. Now it seems like this one's the most, probably the most simple of these, but assessment is always going to come first before making any interventions. You want to assess the patient's oxygen level to determine the next steps. This is a question where you're kind of limited on the information you have, but by getting the oxygen saturation, you can know what the next course of action should be. So that's where that assessment comes in. Question 4. Which patient should the nurse assess first? A patient with a potassium level of 3.2 who reports muscle weakness. B, a post-knee replacement patient requesting pain medication. C, a post-thyroidectomy patient reporting tingling around the mouth. Or D, a pneumonia patient with a temperature of 101.2. So the correct answer here is C, the post-thyroidectomy patient with tingling. Rationale is tingling around the mouth suggests hypocalcemia, which can cause laryngospasms or airway obstruction, and this is a critical ABCs issue. So sometimes the ABCs issue is not a obvious respiratory depression, low respiratory rate, shortness of breath kind of question. Sometimes it's something that you have to know a little bit more about general nursing information and education to understand that this is actually a airway breathing situation. So moving right along, question 5. A patient with a deep vein thrombosis reports a new onset of shortness of breath. What should the nurse do first? A. Reassure the patient. B. Apply oxygen and elevate the head of the bed. C. Administer a blood thinner. D. Call the healthcare provider. The correct answer here is B. Apply oxygen and elevate the head of the bed. Sudden shortness of breath in a DVT patient suggests a pulmonary embolism or PE, and oxygenation is the priority action before notifying the provider. So once again, this comes back to before you call the doctor, what will you tell the doctor you did? Because you are the eyes and the ears for the doctor when you're in the healthcare setting, and they're going to want to know, what did you do before you called me? And they want to know that the patient is not somewhere dying while you're on hold waiting for the answering service. So, question number 6. A heart failure patient gains 3 pounds overnight and has increased difficulty breathing. What is the priority action? A. Administer furosemide as prescribed. B. Educate the patient on sodium restrictions. C. Place the patient in high Fowler's position. D. Obtain a daily weight. So, it says, what is the priority action? Correct answer is C. Place the patient in the high Fowler's position. The rationale here is that this improves oxygenation while other interventions are implemented. Breathing is the priority. So just keep in mind, this is another one where you'd have to know. High Fowler's is usually one of the best positions for respiratory distress. So high Fowler's, and that's going to improve that oxygenation there. Question 7. A head injury patient becomes increasingly drowsy. What should the nurse do first? A. Check the Glasgow Coma Scale, GCS score. B. Check blood pressure and pulse. C. notify the healthcare provider. D, document the findings. The correct answer here is A, check the GCS score. So GCS, it's the best way to assess neurological deterioration before calling the provider. So, when you call, you want to have some information to share with the doctor. And if you call and just say, "Hi, doctor, I'm calling because I have a patient who's really sleepy," the doctor's going to say, "Okay." They're going to ask basically about this scale. What was the GCS? What are their vitals? They're going to ask all those questions. So generally you want to have that information before you call the doctor. And keeping in mind too that a lot of these questions with this information, a patient can deteriorate quickly. And so in the time that you are diverting your attention to making a phone call, your patient could code. So think in terms of, how can I keep this patient alive? What's the most important thing to check to know how to intervene next? Okay. Question 8. A post-op patient becomes confused and has a respiratory rate of 32. What is the priority? A, check oxygen saturation. B, call the healthcare provider. C, reorient the patient. D, administer pain medication. So the correct answer here is to A, check the oxygen saturation. The rationale here is a sudden change in mental status may indicate hypoxia, which must be assessed first. Question 9. Which patient should be assessed first? A, a pneumonia patient requesting a bedpan. B, a post-hip replacement patient with a BP of 88/52. C, a diabetic patient with blood sugar of 190. Or D, a patient scheduled for a dressing change. The correct answer here is B, the post-hip replacement with low BP. So looking at this question here, right away, you can usually see two that are pretty much wrong. So when you're thinking ABCs, you have that patient who just, nothing's wrong, there's no issue, they're just asking for a bedpan. You have the patient who's due for the dressing change. Right away, you know those two are incorrect. So it's between the post-hip patient and the diabetic patient, and you have to determine which one of them has a life-threatening condition that they could deteriorate within the next 5 minutes and code. And most likely that would be the patient with a low blood pressure of 88/52. The blood sugar is slightly towards the higher end of the spectrum, but with blood sugar, it's not usually an emergency unless they're in the 500s and, changing in consciousness, changing in respirations, all that kind of stuff. But 190 is not necessarily an emergency. 88/52 can code at any moment. So that's why that's your answer. I'm moving right along to question number 10. A patient receiving a blood transfusion reports itching and hives. What is the priority? A, stop the transfusion. B, slow the infusion rate. C, notify the provider. Or D, give an antihistamine. So here, the correct answer is A, stop the transfusion. And the reason for that is that this could be an allergic or anaphylactic reaction, which can escalate quickly. The first action is to stop the transfusion immediately. Another little side note about that is when you do stop a blood transfusion, you always want to swipe out that tubing. Some people right away think, oh, you have to flush fluids, and of course you do, but you don't want to flush the fluids through that same line that has the blood in it. You want to disconnect, stop that immediately, disconnect it from the patient, and start hydrating them as quickly as possible according to whatever orders the doctor gives. You want to get some fluids in, but you don't want to use that tubing because that other blood is still inside of that tubing and the situation can continue to escalate if you go ahead and flush through there. That's just another little tidbit there. So quick recap and final tips. Remember, for the NCLEX priority questions, use the ABCs, safety, and the nursing process to guide your decisions. If you found this video helpful, don't forget to like, subscribe, and comment with your toughest NCLEX question. Let me know if you have any other questions or if there's anything else you'd like us to cover in our next video. Thanks so much for tuning in, and you guys take care.